Northamptonshire Healthcare Foundation Trust is a community trust, and we provide a range of services across mental health, adults, children and for learning disability communities across Northamptonshire. It's a very rural county. Some of the workforce challenges are based upon those areas and the transport system. However, when we look at Northamptonshire from an educational perspective, we do know from government research that Northamptonshire is an educational cold spot. We really need to look at the education of our future workforce, right through from schools and then supporting people within the area to join the workforce. We have a very positive approach to learning and development. We work with a number of education providers, and part of that are apprenticeships to support our workforce to grow and develop.
We predominantly work with the Open University over the 4 fields of nursing, so that's mental health, adult, learning disability and children and young people. We also do the Nursing Associate Apprenticeship.
We work in collaboration with the Trust, and my role is to identify suitable people to come onto the programme, and then it's having that continued support, working together to ensure students are achieving what they need to in both the practice and the academic side of their nursing and nursing associate programmes.
Flexibility is important for their work-life balance and commitments to the course, but flexibility is also important to the employer who have the commitments to the patients and the services to run.
I never considered myself as an academic person. The first year kind of eased you into it. It taught me a lot about academic writing. There was always someone available should I need to access that support. I had practice assessors and practice supervisors for each placement, as well as a supportive manager who gave me that time that I needed.
I didn't do too well at school. I joined NHFT as a healthcare assistant, and then since passing the degree apprenticeship, I think it's really important to give people the opportunity to upskill within their role, develop and grow, and whatever I can do to support that I will do moving forward.
I've been working with Lee and Anthony, who now act as practice assessors for some current OU learners, and it's really encouraging to see that they've got this kind of like this full cycle now where they are now encouraging their own colleagues to become OU student nurses and seeing them both develop and flourish, and also remaining within the trust.
The strength of the Open University is across the country, and how practice and learning can be shared to support organisations grow, particularly with the apprenticeship model and how that is going to fit into the government's ambition for the long term. Overall, we have 90 nursing apprentices on stream going through the programme, and the workforce plan just reinforces the model that we're already adopting, that it is a viable workforce pipeline for growing our own staff.
I think the most rewarding thing is seeing students overcome any adversities and the difficulties that they have with balancing studying and working, but being very motivated and determined to succeed.
And it's so lovely when they go from somebody who doesn't know how to study, doesn't know how to use evidence-based practice, and then they get to the point where they're applying for their PIN. It's just such a lovely thing to see.